We're here with Dr. Atwood with Family Tree Dental. And when you talk about orthodontics, you talk about dentists and different people that do different things. I mean, my goodness, everybody wants their teeth looking good and straight, and Invisalign comes to mind. First of all, how long have you been with Family Tree?
About 9 years, coming up on 9.
Yeah, and Invisalign, it's interesting. We feel like it's been around a long time, but it's a lot of advancements here over the last couple of years.
Oh, yeah, you're not kidding there. They put a lot of money into their research and development, and they're on their 8th generation of plastics, right? And when you look at them, they don't look all that cool, right? But the amount of time and effort that's gone into them, what they can do to your teeth is pretty amazing.
When someone comes in for a consultation, or how far down that path, are they pretty certain to know that they're probably going to need Invisalign, or how do you talk them through that process?
Some people have small things that they're concerned about, gaps or crowding, or their bite looks a little funny. Other people have chipping in their front teeth, and they're just kind of curious. And other people are saying, I've wanted this all my life, and I've done all my kids, and now it's my turn. What can you do for me, right? So there's kind of a good spectrum there of where they're at. It's really kind of an easy process, right? Once you get it going, it's not overly difficult. We have a lot of 3D technology now, so we'll 3D scan someone's teeth, right? We can circle all the things they want to fix, and I can circle the things I want to fix. That gets sent straight to Invisalign. We take some pictures, and I can have that worked up within a couple weeks to where I'm really happy, and I think they're happy with it too. So,
at what age would you say you'd be comfortable, or is it person to person?
I think it's person to person. I like to focus on adult teeth. If you have adult teeth, I can go for it. But dentists are comfortable all over the spectrum.
Yeah. And obviously, you guys have a great team here at Family Tree Dental.
Thanks.
And isn't that the most important thing, especially when you're talking about the younger kids or parents trying to make the decision, is you being part of a family, you're going to do it as if it was your own child.
Yes, and I think it's important to be honest. If it's a little bit over your head, right, we kind of know when to refer out to the specialist, right? And we have a lot of confidence in our specialists, but we don't do a lot of cowboy dentistry.
I love it. Well, it's interesting getting the Invisalign, getting someone's teeth looking good. But, of course, there's the other side of it, too. A root canal. When people have to come see you for a root canal.
It's a dirty word to most people, for sure.
It's scary. And the biggest or the scariest thought is, my gosh, I've got a lot of pain. What are some of the hurdles that you think people kind of have to get through to understand, hey, let me go ahead and get this done?
There's a really bad connotation with root canals, and understandably so. Anesthetic has come a really long way, so it's a lot more comfortable, I think, than it used to be. Mainly, it's just really boring now, right? It's you have to be prepared to sit with your mouth open for 1 to 2 hours to get it all the way done. The nice thing about root canals, teeth are fairly simple to get out, but putting them back in is a little harder. So if you can save the tooth and there's enough there to save, it really does a good job of keeping what you have already, and that's a lot easier to work with than some other options. I think that there's a good place for implants, right? Some teeth there's just nothing you can do about, right? But if you can keep what's naturally yours, I feel like that's a really good option to go. I'd say probably the biggest hurdle, right, is when people come in needing root canals, a lot of time they're in pain like now, right? And the quick fix would be just get the tooth out. And I totally can understand that, but some teeth are a little bit more obvious than others. So there are some things that you can do to get the tooth out of pain until you can come back and fix it definitively.
It's interesting. People that come to a dentist, they're like, or any healthcare provider, they're probably going to do what they can make the most money off of, or financially. But saving a tooth, it can also help you with your bite, with chewing. Like, sometimes saving the tooth is the better option.
I would say a lot of times it's the better option. When I consider the timeline of, say, an implant, right? You take the tooth out, and once in a while you can put an implant straight in with the tooth went, right? But in the presence of infection, or if it's just not an ideal position, you have to wait a certain amount of time for the bone to heal, right? And then you put the implant in, and then you have to wait a certain amount of time for the implant to heal. So start to finish, you're looking at maybe 9 months to a year, right? In cases where you really need to preserve that bone site. So, a root canal is you come in, you have the root canal done, and then you usually preserve it with the crown afterwards. And that can be start to finish within the month.
Dr. Atwood, man, we definitely appreciate you. You've done a fantastic job here. I tell you, man, one thing we get from a lot of people is how much they appreciate the one-on-one relationship you have. I mean, to say we're in the dental business or a medical business, but really you're in the relationship business. And I know a lot of our patients are saying that.
Oh, that's kind of them. We're people too. I've been in the dentist chair. It's much more fun on my side of the chair than on the patient's side of the chair. So I get it. Like I don't usually look forward to getting dental treatment myself, but I think that, having good oral health is really, really important, right? And I think it covers a lot. It helps in a lot of areas of our health. So we treat people like we want to be treated, and I like my teeth too.
Yeah, there you go. Dr. Atwood, thank you guys so much. You're fantastic. And
thanks for having me. Yeah.
Our dental team would love to answer your questions and provide the solutions you're looking for. Contact a Family Tree Dental near you.